When we came to Houston, we first met Dr. Kridel. We were really taken with the fact of how personable he was, how engaged he was in trying to build a relationship, honestly, with us, asking just everyday questions, taking so much time. He wasn't in and out of the room really quickly. He hung out and talked to us and really asked questions, gave us time to think about what questions we may have. We talked about the Houston Rodeo, the museums, because we're here for 2.5 weeks. So it was going to be not just 1 or 2 visits, and we were going to be in his town. And he was really, it was like a friend, and I think he knew the importance of building that trust and that relationship with the patients and the family that were going to be here for that period of time. And that was extremely helpful because we felt the confidence that my son was in good hands. And so the results of this procedure, of course, the goal was met. His perforation was completely closed. There were a couple of grafts going on, and we ended up finding out a couple of other issues in addition to the perf once they were in surgery that they repaired, a bone spur and deviated septum and all of that. So, but the perforation is completely closed now, and no whistle. He can breathe through his nostrils with the airflow going straight down without it swirling around like tornadoes with the perf. So we're thrilled.